Hey, it's Jessica DeMassa with WTF Health, and joining me right now I have Atul Butte. He is the Chief Data Scientist, not for the universe, but for the University of California Health System. So Atul, great to have you here.
It's great to be here, great to be here.
It was funny when before the interview when we were talking, it was like going on, and I was like, wait, the whole universe now? It feels like it, right?
It is my universe.
You said how many people? 15 million people taken care of?
University of California is a huge health system. UCSF, UCLA, Irvine, Davis, San Diego, Riverside. I think we've cared for 15 million patients in 15 years.
That's crazy. All right, so we are going to get into a conversation here about EMR.
Yes.
And so you are the guy whose brain we need to pick. So give me a sense of what's going on right now, state of play for EMR in healthcare.
All right, so here's the narrative. I think the United States has spent hundreds of billions of dollars on electronic health record systems. It's about time we actually start to use that data. All right? Okay. In safe, respectful ways, can we figure out what's working in medicine, what's not working, what's missing, right? Let's use that data. I think it's the most expensive data in America. We're paying doctors to type all this in. It'll be a national tragedy if we don't use this data to improve the practice of medicine.
I agree, and I think a lot of people are on board with that. So how do we do it? Because that's where we seem to be getting stuck. It's like the data, you can't get it out, it's in the wrong format, it's unreliable, all of this. So how do we get around some of those problems that are preventing us from making this actually a useful investment?
So a lot of people come at it from different angles, right? You have patients and they're organizing groups that want to get to data, and they should. The University of California, for example, opens up all of the health data to patients through FHIR, the federal standard, even in the Apple Health app. So all 5 academic health centers in the University of California do that. But we can also empower ourselves as researchers, as care providers, as doctors. We are an academic medical center, so we have researchers who want to use this data to figure out what's working, what's not working. We can do cost effectiveness studies. We can compare the costs and the efficacy of drugs in ways probably no one else can in the United States. And it's our duty now to do that. We'll enable others too, but I think it's about time we have to start to enable ourselves to do this for the country.
What's the first step here? Because I mean, there's a lot of people who are stuck with this. It's like, yes, we've got the EMR, yes, we've got things going into it, but it's like, how do you get to that point where you're able to pull some of that meaningful stuff out? It's like everybody wants to get there, but there's a gap right now. So what do you think is perpetuating the issue?
Yeah, so there's a national narrative that it's really hard for electronic health record systems to talk to each other, among other narratives out there. It's remarkably easier when there's a business reason for the health systems to talk to each other. And so I think a lot of people see, barriers, but the barriers aren't technological ones, right? We live in a competitive health system environment where in the Washington, D.C. area, for example, there are competing health systems that they don't want to share their data because those are almost customerless in some ways, right? And in other areas in the United States as well. So I think the more people can think about the alignment of incentives. Why would one want to open up that data and figure out how to help any of the entities in the enterprise, whether it's a pharmaceutical company or biotech or patient support group or nonprofit, why would they want to share that data? Help them accomplish that job. I think the data gets open pretty quickly.
Okay, so about the incentives and aligning the incentives, what's the silver bullet there?
Okay, so, in a 30-second clip, how am I going to solve the American health system, right?
Well, yeah, fix it for us.
Yeah, so I'm just going to look at it from my point of view. I think what the electronic health record data is now the legal record of a patient, okay? With all its flaws and all, it is literally everything we're doing and measuring on every patient. Captured in there are all the kind of moves we make on patients, right? Did we prescribe this drug? Did we order this result? Did we look at this result? I think my own take on it is that we can start to really study across tens of thousands, if not millions of patients to figure out what are the moves in this kind of weird game of medicine are working to get us to a winning state where patients get better outcomes. Okay.
So, I mean, last question for you. Do you think that enough is being done around the health system, and not the health system per se, like the providers, but I mean the bigger ecosystem where we're starting to pull in the payers and health policy and things like that? Is there enough being done to help kind of open this up in the way that it needs to be opened up so that those incentives can be realigned, so that patients can access their data more easily, so that we can start to aggregate things and health systems can share data from one to the other? Do you think enough's being done?
Look, I'm a full-time optimist and a full-time data guy, but I think we got to be careful that data itself doesn't motivate these policy changes that the country is going to need.
Why?
I think the policy changes need to be made, and the data will help then facilitate those. Opening up data doesn't solve the competitive health systems that we work in, right? We have 5 pharmaceutical companies making biologics in certain areas, 6 companies that make insulin. We have health systems that compete literally door to door. Opening up the data doesn't solve that problem, right? I think that, again, I'm an optimist here. I think the data can move a lot, and we've moved a lot in 10 years in this field. But I think more eyes on the actual policies, how healthcare is paid for in the United States, a lot of movement still needs to happen there. The data can enable some of that once it's moved. In the meantime, I think it's going to help us look at, some cost effectiveness here, but in some ways it's almost going to be at the margins compared to the core problem of how healthcare is paid for in the United States, which is a challenging system today.
Right. All right, so as a full-time data guy and a full-time optimist, so self-proclaimed there, right? So tell me what has you most excited about the future when it comes to the EMR and the data that you're going to be able to pull out of it?
Yeah, so electronic health records are so old they're new again, right? I mean, it's amazing. But I think the electronic health record vendors in general do not have a problem with us as providers getting to our own data. That has never been an issue. It's about time we as healthcare providers start to use our data. And it's amazing. I don't think enough of us in our part of the ecosystem use that data to figure out what's actually working for patients.
I think that's great. I love how you articulated that missed opportunity, and so I hope others jump on that. Atul, thanks so much for joining us. It's always a pleasure to get your perspective.
Thanks for having me.
Thanks. I'm Jessica DeMassa with WTF Health. Thanks for joining us.